All right, so we talked about intracellular and extracellular fluid. We're going to move on and specifically discuss extracellular fluid, or ECF. I'm just going to say ECF for now on because it's less syllables. So how does ECF move throughout the body? Well, it happens in two steps. Step one, we have extracellular fluid moving through circulation, okay? Blood is that ECF, okay? Blood moves throughout the body via blood vessels, okay? The heart expands, stretches, has all that blood volume, and then contracts, distributing the blood throughout the body, okay? Giving that blood pressure to distribute that blood, aka nutrients within that blood, to the various tissues that give your body life. Okay? So that's stage one, movement of blood via blood vessels. Okay. Now there's a specific component of that blood, which is the dominant component, which is called plasma. Plasma is that extracellular fluid. Okay, because the other two parts, which are the buffy coats and red blood cells, those don't really count as the fluid. Okay, the buffy coat, which is white blood cells and platelets. White blood cells respond to your immune system. Platelets help with blood clotting. Okay, and we have red blood cells, which are what distribute oxygen. Okay, so buffy coat, red blood cells. Then we have plasma. This is what we're talking about here. Plasma is that extracellular fluid. What does plasma hold? The various substances that are inside extracellular fluid. We talked about earlier, bicarbonates, sodium, chloride, right? Albumin, things like this. Okay? So, stage one, movement of blood via blood vessels. Now, when we say blood, we're specifically talking about that plasma, right? Then, stage two, blood from the heart goes into arteries, right? And then those arteries become smaller arteries, arterioles, and then those arterioles meet at these capillary beds. Okay, this is where arteries and veins interconnect. Okay, this is where arteries come in, get to this capillary bed, distribute the nutrients that it has, and intakes the waste products that the cells have for the blood, and then turns into the vein aspect of circulation. Okay, veins come back to the heart, whereas arteries go away from the heart. Right? So we're at this capillary beds. So stage two is the movement of fluid between blood capillaries and intercellular spaces between tissue cells. We have this capillary bed, and then we have spaces in between cells. So the capillary beds, because of various pressures, substances move out of the capillary bed into these interstitial space or intercellular space. But I'm going to say interstitial for now on. Interstitial space is just the space outside of cells that are outside of cells. So, what accounts for what are these various pressures that lead fluid to go out into the interstitial space? There's a lot. Hydrostatic pressure, which is the pressure from circulation. When your blood when your blood has this pressure throughout circulation, that pressure, when it gets to the capillary beds, is going to push this extracellular solutes into the interstitial space, right? So that's an outward pressure into interstitial space. And then we have oncotic pressure or colloid osmotic pressure. This is inward pressure, bringing stuff back into circulation, back into those capillaries, and eventually veins as it goes back to the heart, right? So what accounts for this oncotic pressure? This protein called albumin, okay? It's one of the solutes present within blood. Albumin is a negatively charged protein that brings stuff back in. Okay, it's this inward pressure, pulls fluid back to the capillaries. Okay, now albumin is a solute. Okay, when we talk about osmosis or the movement of water, water likes going where solute concentration is greatest. Okay, and albumin counts for that solute. So there's a lot of albumin in the blood, which is a solute. Water is going to be like, oh, let's go over here. Okay, because there's a lot of solute here, and we want to equalize. We want to be in balance, right? So water's going to go where solute concentration is greatest. So that is oncotic pressure. So those are two main ones. We can talk about other ones like Brownian motion, which is just how there's always vibration of molecules, and that vibration is greater, it's more intense when there's more heat applied to that area. So the body's around like 37 degrees Celsius. And so the solutes in the interstitial space, for example, will move due to Brownian motion, thermal motion. So that's a little bit about extracellular fluid. I'm going to stop there.